Good morning, good morning, good morning. My
Good
name is
morning.
MarianEAmoa, and I'm the author of Breaking Through the Immigrant Handbook for Thriving in the Workplace. It shares powerful stories. It shares principles and strategies designed to help anyone excel in their professional journey and in life. Today, we are opening up a conversation that is long overdue. What exactly is mental health? And why should professionals, irrespective of your background, and let's say immigrant professionals, why should we pay attention to mental health? To guide us in this conversation, I'm joined by a remarkable mental health expert, Dr. Rosalind Ceasar, who is also a friend, who is here to help us to unpack the truth, bust the myths, give us a language explanation for what many of us have silently carried for years. So help me welcome Dr. Rosalind Ceasar. And so, Dr. Caesar, I'm going to ask you to, take a minute to introduce yourself and please add the fun facts.
Thank you very much, Marian, for inviting me today. I'm very pleased to be here. I am always happy to talk about mental health because a lot of times our ideas about mental health prevent us from living our best lives.
Hmm.
And I'm glad we're going to be talking about this because we tend to think of mental health as a death sentence.
Hmm.
But it does not have to be. It is just it will just be another part of our health
Mhm.
story. And so I am happy to be here. Again, my name is Rosalind Ceasar. I am a clinical counselor. I'm a licensed clinical professional counselor and a board approved clinical supervisor in the state of Maryland. I'm also a national certified counselor. I have a master's degree from Regent University in human services counseling, and I have a doctoral degree in human services from Walden University. I am currently in private practice. My practice is called Ahomka Counseling. I work with adults, children, and teens, and I work with families. And then before that, I was the clinical director for the City of Laurel's mental health program. I'm called Laurel Helping Hands. My special area of interest or my area of passion is working with families who have children with disabilities, helping them understand how to support their children, especially in the educational process, because that can be a little complicated. And education of children with disabilities causes a lot of stress for families and affects their mental health. So that is who I am.
Oh,
Thank
thank you,
you.
thank you, thank you, thank you so much. Doc Rosalind, thank you so much. I mean, the one thing you just said that having mental health issues is not a death sentence. So I'm glad that you're going to unpack this. Let me just say that this will be three series. So this is part one in the series. So my first question is, what is mental health? I mean, growing up here, mental health in Ghana, where I'm from, and here, it's always has a stigma. Nobody wants to talk about it. So, can you please break it down for us? What is mental health?
Okay. So I'll start with the formal definition and then I will break it down into everyday terms. So the World Health Organization defines mental health as a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. So when you listen to this definition, it doesn't talk about what is wrong. It just says that you can function. So when we talk about mental health, we talk about your ability to function, not whether or not there is a problem. And I will illustrate it. So when I break it down, I will illustrate it with you're wearing your glasses now. I also wear glasses. Okay. A lot of people need glasses either to read or to see because they are long-sighted or they're short-sighted.
Mhm.
We don't think of ourselves as not able to function because
Mm.
we need glasses. Because once we put our glasses on, we can do whatever we need. So if we translate that to mental health is a state where even if you have a problem, you have a mental condition or a mental illness, you have the resources or you have what it needs to cope so that you can get on with your life. Now, without my glasses, I can barely see my TV in my
Mm.
house. So then I have a problem. But with my glasses, I can see everything. So I have no problem. If we apply that to, we parallel that to mental health. It means that I can have a mental illness or a mental disorder, which could be a problem if I didn't do anything about it. But if I did something about it, or I treated it, or I made the right changes, I could get on with my life, and it would be a ping on the radar, if at all. Okay. So, having said that, so let me go ahead and explain what a mental illness is as well. Okay. Because we've talked about mental health. So mental health is not a state of no illness. It doesn't mean the absence of illness. Okay. Mental illness is a disturbance in an individual's cognition. That's how we think, in their emotion regulation, or how we feel, or in behavior, how we act, that causes distress or disability in social, occupational, or other important activities. And this is a definition from the American Psychiatric Association. So what it means is that if somebody has a mental illness, either the way they feel, the way they think, or the way they behave causes them not to be able to function properly in the way that is normally accepted in the culture in which they live. Okay, so I'm sure that we'll end up talking some more about culture, but we need to keep in mind that to some extent, mental illness is defined by culture, because there's some behaviors that are acceptable in certain cultures, but are not acceptable in others. Okay. So that is mental illness. There's a disturbance. A mental illness does not necessarily equate to a mental disorder. So we have mental disorders, which are, like, I like to explain a mental disorder like a mental illness that has a name. It has been christened. We have given it a name. We've put a label on it. We've put a bow tie on it. We've said when all these things come together, we call it this. So a person can have a kind of mental illness. They can have a mental illness without necessarily having a disorder, because what they have does not have a name. It's a mixture of things. So we don't have a specific name for it. So if you think about it, you can say you're not feeling well. You are ill. You don't have a name for what is going on. So maybe you go see a doctor. Yes. But it is there. Okay. So we can have illnesses and we don't have a name for it, but it's present because something is not going well with how we behave, how we think, or how we feel in terms of the places where we live. So so that is how. So think about them in those three different ways. There's mental health, mental illness, and then there are mental disorders.
Okay. So I'm learning along with my those who be listening to us, those who be watching us. I'm learning along with it. You know, when people say, so I want to bring it to everyday parlance, you know, how we say it. I'm taking a mental health day. Like we will say mental health day, I need a break. It might be that there's nothing wrong with you. You just need a break. Or it might be that you are having high levels of stress. Please break that down for us.
Okay.
When people say mental health, I'm taking a mental health day.
Yes. So people typically will say they're taking a mental health day or they need a mental health break because they are feeling stressed. But if we think in terms of cognitions, emotions, or if we think in terms of feelings, thinking, and behavior, it means that if at any point I think that I am not acting the way I normally should or the way I do, I'm not feeling the way I do, the way I normally should, I'm not thinking the way I do, the way I normally should, then something is going off of my normal. And I feel like if I take a day off, it will help me recover. I will come back to it. Something we tend to do is to think of mental health like it's in a whole class by itself. We don't parallel our mental health with our physical health. But if you think about it, mental health kind of sounds like all the disorders, again, that have to do with non-physical structures in the body, because we are talking about how we think, how we feel, how we behave. We can't touch an organ and say that this is not working well, that is why. But we can do that for physical disorders. But if we parallel the two of them, we will realize that our mental health and our physical health are pretty much the same because they are all connected with our body. Yes. So if I wake up in the morning and I feel like, my throat is kind of itchy, I probably shouldn't go out because there's too much pollen out there. I could also wake up in the morning and feel like, you know what, today I'm feeling a little anxious. I shouldn't go out there. Or today I'm not feeling in a very good mood. I'm a little irritable. I shouldn't go out there, so that I can calm down and get myself back to where I need to be. So when we talk about taking a mental health day, that could be a situation where that makes sense.
Yeah. So okay, let me just back up. I'm really enjoying this. So I like the WHO, World Health Organization definition that you have just shared. State of well-being, the words that are state of well-being, potential, community, ability to function. So, Doc, would you say that we all have mental health? I mean, we all do, but it's a spectrum. I just want
Precisely.
our listeners and our watchers to get mental health. When we say what is mental health, I want us all to get it and get it right.
Okay. So in the same way that we can all have varying states of physical health, depending on what's going on in our life and what is happening, what stage of development we are in, we all fall on a spectrum of mental health, depending on what's going on in our life. So if you think about it, if you are somebody who has seasonal allergies, in the spring, you are going to have a problem with allergies unless you've seen an allergist and you have your medication ready. So in the same way, we can all have mental illnesses depending on what seasons or what times we are in. If you are a new parent, it's very stressful. Let's say a mother new parent, it's very stressful. You're probably not getting a lot of sleep. Your body's exhausted from delivery. All these things can add up to your body, your mind, and your emotional functioning going down, so that you are not really performing at your best. According to the definition, you are not performing at your potential. You're not maximizing your potential because something is off. So when we think about mental health, we should parallel it with physical health. At any point in time, we fall on the spectrum somewhere, depending on what's going on with us. In the same way that there are people who are born with type 1 diabetes, and from the time they're children, they have a problem managing their insulin. We can have people who are born and they have certain types of mental disorders. Like we talk about ADHD, autism spectrum disorders. Okay. Then there are people who develop type 2 diabetes as they go along because of their life conditions. So there are people who develop mental illnesses because of their life conditions. So if you go through trauma, you could experience PTSD, post-traumatic stress disorder, because of your experiences. So we need to think about mental health and mental illness as something that occurs on a spectrum that applies to everybody, depending on what's going on in your life at any point in time. And the same way we go check up and make sure that our physical health is good, we should be doing the same thing for our mental health.
Okay. So I'm hearing that if the definition of the think, feel, and behave, right, that mental health, all in that range, I'm hearing that from and also what you're saying, the physical health. So if my throat is itchy, right, it will not help me. I can't function at my best, right? Yes. And so that itchy throat has an impact, in my function, whether it's my hands, it has, and you would put that also in mental health. Are you, just for clarity?
So your throat can be itchy.
Yes.
But it will not affect any aspect of your mental health, because it will not cause problems for you. It will not cause distress for you, or it will not cause social, occupational, or other functioning. So my throat is itchy. It may make me cranky and irritable and get me in a fight with somebody. At that point, it has become a mental health issue.
Exactly.
Before that, it is just an itchy throat. a purely physical thing. So when we think about mental health, again, the key thing is that it is creating distress for me. My throat is itchy. My throat itches all the time. And now I'm starting to worry. And every time spring is coming, I become very anxious. At that point, my itchy throat is also becoming a mental health issue because it is causing anxiety for me. Or it is causing me to get into fights with people because I'm irritable. I want them to leave me alone. Or I'm stealing money to go see the allergist. It is causing dysfunctional behavior. So if the thing in itself does not create a problem for me or for my functioning, then it's not touching our mental health. Once it touches those areas, creates problems for our functioning or for us, then it has gone into our mental health area.
Yes.
That is why, again, that is why cultural factors become important, because there are behaviors that if you did in certain cultures, nobody would have a problem with it. So if you did it, it would not create distress for you, or it would not affect your functioning. But if you did it in another culture, everybody would disapprove of it. So it will create a problem for you. Because nobody understands you. So that can create anxiety, it can create depression, it can create all kinds of behavior.
So when we talk about, there's something that I talk about sometimes, is that when you're dealing with people, even at work, remember that they're a total being. And sometimes it's something that is causing a particular behavior. Right? Maybe my throat is itching, it's making me anxious, it's making me angry, right? And then I come and you're not understanding me, you're not trying to see, I've made a little bit of a mistake and you go all off. So just knowing that people come with their total self. So this is really enlightening for me. So that physical discomfort, could affect how you behave, right?
Exactly.
And that is where you've gotten into the mental health
area.
Okay. So I think that just asking the question somebody will ask, you've explained the mental health, we are all on the spectrum. I know that you explained the mental illness. Can you reiterate that again?
Okay.
The difference.
So I like to tell people, if it is not a problem, it is not a problem. When it becomes a problem, then it is a problem. So when we want to think about mental health, we want to think about how we think, how we feel, and how we act in terms of how much problem it creates for us and for other people in our functioning. So for instance, if talking about immigrants, and let me go to African immigrants, just because of that's where my experience mostly is. The average Ghanaian, if you tell them that your dog died, okay, your dog died, so what? Okay, to them, a dog is not a pet to the average Ghanaian. A dog is either a service animal or it is just an animal out there. They don't attach emotional value to the animal, to the dog. Okay. So in that culture, if somebody's dog died and the person was distressed, in that culture, there will be a problem because their distress will not be acknowledged. It will not be validated. Okay. At that point, their distress is going to create a problem for them because everybody's going to look at them like, what is wrong with you? Okay. Why are you so distressed about your dog dying? If you transpose that same experience into America, it will not create a problem because everybody will understand your dog died. It is a big deal. You will get the support you need. So mental illness, think of it in terms as if at any point at all it creates any kind of problem, then it is an issue that needs to be addressed. If the way I talk to you makes you not want to talk to me back, makes you upset with me, how I am talking is now going into the area of mental illness in the sense that my way of talking is creating problems for me in my relationships with other people. And so I have to address it. If the way I talk to people is okay and everybody is comfortable with it, then it is not a problem. So that's how we need to think about mental illness. It does not matter whether everybody does it or everybody doesn't do it. If it creates a problem, then it is a problem. I was talking to somebody once about and I was explaining domestic violence. And they were saying that, as I explained it, they said, I have never thought about these behaviors as domestic violence. And I said, it is domestic violence because even though it is culturally accepted, the people who are at the receiving end of this behavior are affected negatively. They're just taking it. Okay. So at that point, it is a problem because somebody is negatively impacted.
Yeah.
And we have to acknowledge it. So we want to think about mental illness in that way. If it creates a problem, then it is something we need to think about.
Okay. So would you say that so I hear problem like pattern, would you add the word pattern to it?
Okay. So when we tend to describe mental illness, to diagnose mental illness, we look for a number of things. For instance, we look at when did it start? How did it start? What was happening when it started? We are definitely looking for a pattern of some sort.
Okay.
Now, in certain disorders, there may not be a pattern, but we are looking for maybe a situation. So for instance, and when we talk about post-traumatic stress disorder, we are looking for a pattern in behavior that has occurred over time. But we are also looking for an incident that may have occurred at one time or has recurred over time. And we tend to describe medical disorders in terms of subclinical symptoms. So are you displaying, like you said, are you displaying these patterns? Are they at the level that we are concerned about? Or it is not enough for us to be concerned about it as a big deal, but it is present. We describe it as recurrent. Is it something that comes and goes all the time? Or it's something that happened once in response to a situation? Or is it something that happens over and over again, but at this time it is not happening? Or is it something that is chronic? Because there's some mental disorders that we consider chronic in the sense that a person does not necessarily recover per se. Once they start demonstrating it, they may feel better and do better, but it will always be underlying, and there's always the chance that it may come back again. We can describe them as severe in terms of how they impact your functioning. So if it is so bad that you're not able to go to work, you're not able to take care of yourself, you're not able to take care of your children, that's severe. But it can be mild. So that it is present, but it's not really impacting you too bad, but you know that you're not really maximizing your potential.
Yeah. So I know we'll be going into a part 2, but just give me a few. I'm just thinking about why we don't talk about mental health in some cultures.
Okay.
And why it's so stigmatized if we are all on a mental health spectrum. One thing or the other can influence the way we think, the way we behave, and the way what was the third one? The way we feel. So think, feel, and behave. So is this something that you can address, doctor?
So I couple of things could explain the stigma. And just in terms of my experience working with people, because we don't talk about mental health in the same way we talk about physical health, people tend to think of mental health as some strange thing out there. A lot of the experiences that we all have actually fit in a mental health case, and they are diagnosed. They are classified in the diagnostic manual as mental health illnesses. So we don't think of insomnia as a mental illness. But if you have insomnia that meets certain criteria, you actually have a sleep disorder. Okay, so I am sure that a lot of menopausal or perimenopausal women would meet criteria for a sleeping disorder just because it comes with the territory.
Yeah.
Okay. The other piece is that, again, for physical illnesses, most of them can have tests that say that, okay, your pancreas is not working well, or your appendix is not working well, and the doctor can isolate a specific organ. And so we know that it is this organ that is not working well. When it comes to mental health, we are not yet in the place where we can say that, oh, we know that this particular part of your brain is not the part that is not functioning as it should. And this is what we need to do about it. And it will get you to that stage. There are studies going on, and I was excited to read that they are mapping the brain now. And so we could get there someday where doctors will be able to go in there and say, this is the part of the brain that is not working well. That's why this is going on, and this is what you need to do. But for mental illnesses, for the most part, it has been kind of ambiguous. And so they have always been explained under spiritual and cultural beliefs. Which, of course, we know most of them, they are not accurate because they are not scientific. And so there's some mysticism associated with them. And those all add to the stigma. Another piece is that because of the mysticism, we have not always known how to treat mental illness. And so people view it as like a deficit in your character, as opposed to and again, it is something that's going on in your brain, the organ of your brain that's creating this. But we don't tend to think of mental illness as a function of the organ.
Yeah.
Okay. So all those things add up to the stigma.
Okay. I'm sure we can get into that stigma thing. I just want you to, from what you said, we've even talked about how mental health, somebody dealing with an issue that is affecting their behavior, the way they think and feel, can manifest in the workplace. How about in our homes? How give us a few tips, because it could be a spouse, it could be a family member, it could be a relative that is dealing with something that is affecting their behavior, right? And sometimes it can easily be overlooked, or sometimes when it's a child, you say, yeah, why are you always misbehaving? So can you just deal with that? And then after that, one more question will end the session.
Okay. So when we come to the home, there's a lot of genetic components to mental illness. It tends to run in families. And so what I have seen is that if there is something that tends to run in the family, especially if it is not a chronic, severe disorder, people tend to just assume that this is normal because this is what they have seen. And a good example is ADHD, attention deficit hyperactivity disorder. It tends to run in families. And so if you see a child with ADHD, there's a good chance that one of their parents has it, or anxiety. If their parent doesn't have it, their parent has a relative who has it, a close relative who has it. So if a family anxiety runs in the family, in a certain sense, the family members are used to behaving in a certain way. So if a child is also demonstrating it, or if somebody is demonstrating it, they view it as normal in their house. That's what they do. Okay. If they don't think of it as a problem in terms of relating, think of it as how it affects their relationship with other people, then as far as they're concerned, this is how they behave in their family. It's normal. So they don't do anything about it. Okay. If you take people who are controlling, obsessive compulsive personality disorder is a mental disorder that has to do with control, because the level of control people want to exercise. In a culture where men are allowed to control everything, and it is accepted, if somebody has a disorder based on control, they can get away with doing whatever because the culture accepts that level of control. So they may say, oh, he's a little more controlling than everybody else, but that's what men do. So that is how some of those things tend to manifest. So the parent is very controlling, but the culture allows it to be so because children are supposed to listen to their parents. As long as it's a parent, then even if you're 65, You're supposed to do what your parents want you to do. So it's things like that. And those are other ways in which those are some ways in which mental illness may manifest in families.
In families.
You can have it occurring in terms of even just how people parent. Okay, if you have a parent with a mental illness, it affects how they parent. For example, if you have a parent who is depressed a lot, it means that they tend to not be as active and proactive as they need to be. It's going to affect how they parent, because if they need their child needs them to go out there and maybe advocate with the school, the parent doesn't have the energy to be able to go and do it. The child is going to lose out. So those are some ways in which mental illness kind of shows up in our lives insidiously, and we don't even realize that that's what's happening.
Yeah. Well, now that you're talking, it reminds me of when I was in college. There was someone who get into exams, they will always have some kind of outburst, so they're not able to cope, right? And now that I think it could be the load of work that had to be, or the amount of learning that had to take place. And so that person would always sort of go off. And I don't know whether it was diagnosed, but these are all signs of.
Yes. Those are all things to look for. Those are all things to look for.
Yeah.
I think that sometimes we tend to ignore these things because, again, if you think about mental health and mental illness, it's on a spectrum. So a lot of it's like we will all say, of course, we all get stressed before exams. So that if you are having this level of outburst, you are overdoing it, because we all have stress. Why are you taking it this far? What we are not recognizing is that even though we all have stress, this person's level of stress is clearly out of proportion.
Yes.
And they are not able to manage it. What the rest of us are able to do is to manage it. This person is not able to manage it because of the level of stress they feel. And so now it becomes a problem because they are having these outbursts that are creating problems for them. If they had that level of stress, but they could figure out how to cope and manage, it would not create a problem. So at that point, we are not concerned about it.
We need a full day we need a whole workshop for just what is mental health. So give us a few parting words, give us a summary. That would be great. But I can't say thank you enough. This is a journey for me. I'm learning, and for our listeners and those who will be watching us. So just summarize today's session. I've learned a lot, the ability to cope, function, community and all that. So give us your closing remarks, and maybe you can give us a teaser into the next one, which is why it is important and how to manage mental health.
Okay. So I think we've talked about mental health as a state of well-being.
Yes.
It is not the absence of mental illness. It is not the absence of problems or challenges. It is the ability to cope and function and maximize our potential in spite of all these things. And mental illness basically is any change in our behavior, our thinking, or our feeling, which causes distress for us or causes problems for our functioning in our society or in our culture. That every mental illness or mental health occurs on a spectrum. So at any point in time, we all have varying levels of mental health or mental illness, depending on what's going on in our life. Every mental illness does not necessarily translate into a mental disorder, because a mental disorder meets very specific criteria. But so we can have a mental illness without necessarily having a disorder. The last thing I will say before I end on this summary is that a mental illness is not a death sentence. A mental illness does not mean the end of the world. There are people who are successful. And when I say successful, I mean they are the people that we think about, and it's like, these people are all in a class of their own because they're not like us. They are so good at what they do. And they have mental illnesses. We think of, and three of my people that I like to use, one of them is Michael Phelps. I mean, we all know that Michael Phelps is in a class of his own as an athlete. Okay, Michael Phelps talks about anxiety, depression, how he has been on the point of suicidal. I have heard his mother talk about how he had ADHD as a child and how swimming helped him to cope at that stage. So we can have all these mental disorders and we will be fine. We will function. Whoopi Goldberg has dyslexia. It is a reading disorder, a language processing disorder. She talks about how she dropped out of high school because her teacher said she was stupid. And if you think about it, it is ironic because an actress is working with the language all the time. They are memorizing language all the time. And the woman has dyslexia. She is an EGOT award winner, which is a class in which there are, I think the last time I checked, is it like only 100 and, I've forgotten, I had a number for how many people are EGOT winners. It is only a few of all the actors and actresses we know. So we are talking about people who are in a class by themselves. There is a Nobel Prize winner who has schizophrenia. And schizophrenia is along the lines of when we talk about severe mental illness, that is really at the end of the scale. And he's a Nobel Prize winner. So what I want you to understand is that when somebody says you have a mental illness, it just means you have a mental illness. It says absolutely nothing about the quality of life you can have. You can have a great quality of life, irrespective of what mental illness you have. You just need to know it and take the right steps and you will be fine.
Wow. Thank you so much, Dr. Rosalind Ceasar. Thank you for sharing your wisdom today. I have learned a lot. I have learned a lot. Mental health illness is not a death sentence or the end of the world. Thank you for watching us today. Drop in a comment what stood out to you. What are you going to commit to do? And if this conversation spoke to you, don't keep it to yourself. Share it with a friend. And thank you, thank you, thank you. We will see you in part 2 when we talk about why it's important. Part 3 will be how to manage it. So thank you all so much for joining us today.
Thank you for having me.